First on Fox tonight, Oregon health leaders say we could be mere days away from seeing the peak of the Omicron wave.
But we know tonight local emergency rooms are already bursting at the seams. Today, the Oregon Health Authority is reporting more than 8,500 new cases of COVID-19. Right now, 921 people are battling the virus in the hospital. That is 10 more than yesterday. But we've learned that does not include emergency room patients.
Well, Fox 12's Bridget Chavez joins us now live with more details on the impact the current surge is having on ERs in our area.
And you might be shocked to hear how and where they're having to treat these patients. Bridget, how are they dealing with this influx?
Yeah, Nora, the medical director of OHSU's ER says again that they are at double and even triple the capacity like you mentioned. She says even at points they've had to board patients in their cars while they wait for hospital beds. And they've even had to see patients in elevators and lobbies.
Emergency rooms are overwhelmed by Omicron.
Typically, we had an average of about 91 patients coming in per day. Now we're seeing up about 160. And with only a 31-bed ER, you can imagine that's a lot of patients.
As of today, there are 82 patients currently hospitalized for COVID-19 at OHSU, but that number does not include those in the ER. And Laura Chess, the medical director of OHSU's ER, says they're overflowing with patients.
We have converted our auditorium into a treatment area. That was in addition to adding, I believe, 22 total of possible hallway beds for patients. And that's in addition to patients being seen in the lobby, seen in our triage area, our urgent care area, over in the pediatric side. At one point, we even had patients, boarding in their cars, being seen in elevators. And just to be able to have a place to take care of patients.
She says the ER is getting hit hard by this current surge and that part of the problem stems from people coming in for symptoms that can be managed at home.
They are taking up quite a few of the lobby chairs, if you will. But unfortunately, too, the large majority of patients that we're seeing admitted from the ER are those who are unvaccinated who are testing positive for Omicron.
They're also seeing patients who have delayed care for other conditions through the pandemic.
Due to the backlog of outpatient clinics, dialysis centers, what have you, of patients not being able to get their routine follow-up care, we see more and more patients now coming to the ER for management of those illnesses.
Chess says more than ever, it's important to only come to the ER for true emergencies.
We recommend that patients who aren't sick, if it's not an emergency, utilize your community resources, your outpatient COVID testing, your government distributed tests, and leave the emergency room for those patients who need it most.
Chess also tells me that they're facing staffing shortages, and that's only adding to the backlog of patients waiting for often hours before they're seen. Reporting live in Northwest Portland, Bridget Chavez, Fox 12 Oregon.